So in fact, there is studies from these in Malaysia. They do survey about how frequent people have awareness to go check up. I think I'm okay. I can eat. I can move around.
So I will take a blood test, maybe once every 2 years, 1 to 2 years. Take one blood test. Hello everyone, welcome to MySelfCare podcast. I'm Kongzi, your host for today's podcast. So September is a special month as we are here to celebrate the World Heart Day with the theme Use Heart for Action. So today is our pleasure to invite pharmacist Peggy to talk more about the myth of heart disease and some tips to take care of our heart. Welcome, Peggy.
Oh, thank you, Kongzi, for a very warm welcome. I think it's a very good questions that Kongzi do during the introduction. So, what are the actions you are taking for heart health? I think this is a good question to ask around our friends and family members. So, Kongzi, what are your actions you are taking care for your heart health?
Normally, I will do exercises, probably 2 to 3 times a week. Usually I will do more like jogging, running.
Oh, that's very good. Very good routine of practice and exercise.
How about you, Peggy?
Oh, thank you for questions, Ho. I think I have been taking care of my heart health by starting jogging. I started back 2 months ago because I realized it's very important to taking care of our health. I started back 2 months ago. I started with short durations around like 10 to 15 minutes of jogging. Then I keep it in a routine like 2 to 3 times per week. And I also very cautious with my food selection as well because I have my parents both have a high cholesterol level. So I have that genetic inheritance, so I also do have high cholesterol. So when it comes to food selections, I also will be very careful in choosing the healthier options of the food. So in fact, today we'll be talking about heart disease. So you all will be familiar with the term cardiovascular disease. So what is this cardiovascular disease mean? It means it's a class of disease that is affecting our hearts and blood vessels. And throughout my years of practice as a pharmacist, I realized Malaysians populations have a misconception about cardiovascular disease. Because for them, they realize once I got it, or I can't do anything about it and I can't do any prevention. But in fact, we can.
Yes, Peggy, I agree with you. Even my friends and family, they are not aware about the importance of taking their heart health.
Okay.
So I think to take care of our heart health, we must know the risk factor and also what we can do about it to reduce the risk of cardiovascular diseases. So Peggy, actually I do realize there are some myths about cardiovascular disease, and let's go through one by one and maybe you can share your thoughts.
Okay, sure. Let's go through that.
So, myth number 1, cardiovascular disease only affect older people. So Peggy, what do you think?
Actually, that is not true. Actually, cardiovascular disease, it do affect at all range of age. It can affect the children, even adults. I think children-wise, normally it's due to genetic factors that causing their heart to have a problems or having some heart disease issues. That is genetic. That one is something we cannot do anything about it because it's due to genetic cause. But then for adult case, like in Malaysia recent years, there is even like recent years there's an increasing trend of young people like as early as 30s or 40s are getting cardiovascular disease, and this is a very alarming issue. As according to the Malaysian statistics recently, current data, the age of the Malaysians getting CVD is around average age of 56 to 59 years old. And in fact, in some developed countries, their age of developing CVD will be much more in the elderly, like 63 to 68 years of age. So you can see that in compared to Malaysia's, actually Malaysians population is getting having CVD cases at earlier age. In fact, yeah.
Okay, myth number 2. Only men are at risk at cardiovascular disease. So what do you think, Peggy?
Actually, both cardiovascular disease is just not a man's thing. Actually, men and women will be equally having a risk of cardiovascular disease. It's just that women they will develop cardiovascular disease at a little bit in a later age.
Oh,
Yeah.
is it why women actually will develop a little bit later?
I think naturally we have the women's hormones. Actually, women's hormone naturally act as a to prevent cardiovascular disease from happening. So when a once they reach menopause, so they are not much they will be stop producing all the woman hormones. That is where the risk of cardiovascular disease developing will be much more higher actually.
I see.
Yeah.
So is there any difference between men and women when they start to present with cardiovascular disease?
Actually, in fact, in studies, it shows that when both men and women they started to develop cardiovascular disease, women will be more presented as stroke events. But then, however, for men, when they are having these cardiac events, they were more towards having heart attack events. So it's quite a different presentations in fact.
I see.
Yeah.
Okay. Myth number 3. Cardiovascular disease is always caused by a family history.
Actually, not really just about family history that will be increase the risk of cardiovascular disease. Actually, lifestyle factors also play an important role as well. So, Kongzi, have a guess. What are the lifestyle factors you think that it will increase the risk of cardiovascular disease? Just have a guess. Yeah.
Okay, I think basically it's unhealthy lifestyle. So such as like unhealthy diet, not exercising, heavy smoker, alcoholics, and I think those like pre-existing of medical conditions such as like high blood pressure, high cholesterol, and diabetes people, they are also contribute to risk of getting this cardiovascular health.
Yeah, that is true. I think even like obesity also, like people they don't when they not practicing healthy lifestyle, they are getting fatter and fatter. Obesity also contribute that factor also. So yeah.
So it's important to actually maintain healthy lifestyle.
Yes, it's a very huge factor. So in fact, when we talk about risk factors of cardiovascular disease, it is divided into 2.
Okay.
Just on what you have mentioned just now, we call it modifiable risk factors.
Okay.
Yeah, means something you can do about it.
Okay.
Like just now you mentioned, I can make changes. Have practice healthy lifestyle. This is something you can take control.
You can do something about it.
Yes. But then there's another risk factors. We call it a non-modifiable risk factors. Means it's something you cannot do anything about it because it's due to age factor, genetic factors. Like if let's say your parents having just like me, my parents having high cholesterol level, so I have the genetic of having high cholesterol as well. Genetic factors. And the third one is family history. If let's say your parents or your grandparents having family history of heart attack before, stroke before, all these, you yourself will be having a high chance of getting it.
Number 4, cardiovascular disease is mainly a problem for wealthy and industrialized countries. So what do you think, Peggy?
In fact, actually, this cardiovascular disease doesn't limit to wealthier countries or industrialized developed countries will have more cardiovascular disease. Actually, it affects globally. It's one of the very global challenges right now in tackling this cardiovascular disease. But then there are surveys they found that compared to those developed countries, compared to the low middle income countries, in fact, actually low to middle income countries, the death rate of cardiovascular disease is 40% more than developed countries. Okay. So there's a misconception they will think that wealthier country, will be getting more good food, sedentary lifestyle. But then, in fact, it's the opposite.
I see. So Peggy, you are telling me that lower to middle income countries actually will have higher death rate.
Yeah.
So why is it so actually?
Actually, it's back to the country's policies and healthcare access. Because I think that for low to middle income country, they do face challenges on how they want to increase medical access, that means treatments for these people. And sometimes some even very poor countries, their accessibility to healthcare system is even very hard. So this leads to sometimes it might be late diagnosis of the patients, late treatment, and that is the reason it contributes to higher death rate in low to middle income countries. Yeah.
I see.
Yeah.
So I think in Malaysia we are quite fortunate that
Yeah.
we are easy to access all the healthcare system that some pharmacies actually like offering basic health check,
Yes,
like
yes.
glucose test, blood pressure test,
Yes.
and also
Cholesterol
test.
test,
Yeah.
yeah.
So even a lot of hospitals also start offering those medical checkup packages.
Yes. It's quite common in Malaysia, in fact. Yeah.
So actually, I have a data here telling that it's actually from National Health and Mobility Survey.
Yeah.
So this data actually telling that about only 34.6% of Malaysia population have only done medical checkup, which is quite low.
Yeah, which
right?
is quite low.
So
yeah.
actually, we need to increase the awareness of taking good care of our health.
Yeah, it's very important to do that, in fact, yes.
Myth number 5. If someone does not have any symptoms, their heart must be healthy.
That is not true, actually. No, we still need to go do checkup to see whether we have any issues or not. I think those like high cholesterol and high blood pressure, I think these two are the major risk factors for cardiovascular disease that we mentioned just now. Actually, they don't show any symptoms. So you don't know until a day you go check out and find out whether you are having a risk of cardiovascular disease or not. So in fact, there is studies from these in Malaysia. They do survey about how frequent people have awareness to go check out. And in fact, Malaysian population, 2 in 5, that means 2 out of 5 people, they don't really do checkup. And the top 3 regions, they don't do checkup. First, they think that no time constraint. Second, they will think that I'm healthy lah. Why should I do checkup? I think I'm okay. I can eat. I can move around. Yeah. And the third reason is they don't have any symptoms of it, so they don't think they should go for checkup. But in fact, just as I mentioned, blood pressure, high blood pressure, and high cholesterol level, they don't show any symptoms. You will only find out when you have it. So I think it's better to do checkup as early as possible. So, Kongzi, do you do medical checkup or do you know your blood pressure readings or not?
Yeah. I think I'm one of the 2 out of 5 people. Statistics. Actually, I do regular checkup.
Oh, that's good.
So I will take blood test. Maybe once every 2 years. 1 to 2 years. Take one blood test to check. And also, actually, it's important to talk to the qualified medical professional. So about your cardiovascular disease. So take any test they are recommended, even though you are healthy.
Yeah, it's better to get as early as possible. Yeah.
Okay. Thank you, Peggy, for answering all the myths. So it really cleared my doubts, and also I think it is actually beneficial for all of us.
Yeah.
Okay. So now we know about the risk of cardiovascular disease, the symptoms, all that, and then I think it's time to know like what can we do to prevent cardiovascular disease.
I think there are five points here. So to remember, it's about managing our risk factors. First, it's about healthy diet. So when it comes to choice of food, opt for healthier options, less fried food, less processed food, and more and less fatty food. I think that is very important. If you are able to cook yourself at home, it will be even more better options. Second, is about regular exercise. Really, exercise is very important. So, because in fact the research have found that exercise do reduce the risk of cardiovascular disease, and in maintaining your weight as well. According to a guideline, in fact, we need to exercise like per week, 150 minutes per week. That is a standard one. But then you can go slow, then increase that frequency and durations. Okay? So, in fact, their studies, I think this is very important when we talk about exercise, because Malaysians' obesity rate in Malaysia, adults, is in increasing trend. I think I have a study here. In 2011, the number of people of Malaysian population having obesity is 44.5%. But up to now, latest one, 2023, it has been increased until 54.4% of Malaysian population having obesity.
There's a lot, half.
Almost half, yeah. This is very alarming issues that we need to look into it. And exercise is one of the factors to reduce your weight. Yeah. Okay, there's the second one. Third one is smoking, to quit smoking. In fact, actually, do you know actually inside the cigarette smoke, actually, there are 7,000 plus of toxic chemicals. So all these will contribute to increase the risk of what we call arteriosclerosis. Meaning, arteriosclerosis means blockage in the blood vessel. There's a fatty deposit inside your blood vessel, and it causes blockage and increase that risk as well, actually.
I see.
Yeah.
I see. And I also heard that smoking actually will cause blood to become viscous. Is it true, actually?
Yeah, actually, it do cause blood to be very more viscous. So when your blood become more viscous, your heart will take more energy to pump the blood throughout the body, because it becomes viscous, it doesn't flow very smoothly. So it's somehow also burdening your heart as well. So this also will increase your high chance of getting the cardiovascular disease.
I see.
Yeah, so smoking, please stop smoking. It's really not good.
So yeah, I think most of us know that it's important to quit smoking. But actually, how significant is actually quit smoking can improve our health?
Actually, if let's say you started to quit smoking after 1 year of quitting smoking, actually the studies found that your risk of getting stroke and heart attack reduced by 50%. Just 1 year only, 1 year of quitting.
That is a lot, actually, 50%.
Yeah, 50%. That is a lot, actually. So it's very significant impact. And they also found that in let's say after you quitting or smoking after 5 to 15 years, actually your risk of getting stroke and also cardiovascular disease is back to like those that never smoked before. So it's back to zero.
I see.
Yeah, so that is a huge benefits of quitting smoking, and smoking is not good.
Yeah.
Cigarette is also very expensive.
So it's actually very important to
quit smoking. Yeah, that is number 3, quit smoking, and number 4 is managing your stress. Yeah, I know it's not easy, especially when we are living in a life of busy, working, like working late until night. But then still you need to manage your stress. Like give yourself like maybe half or 1 hour time to do some. You can go for those meditations, yoga, like to calm down yourself, and also like some people practice deep breathing, like counting your breathing, closing your eyes. I think these do helps as well. That's number 4, managing your stress level. And then the last one is, if let's say you already have the pre-existing medical condition like high blood pressure, diabetes, or high cholesterol level, take medications. Have this at optimal level. So once these are and monitor it, because it's very important. Once you monitor and take medication, I think it won't exacerbate to yourself to increase further risk of cardiovascular disease. Yeah.
Very important to actually talk to your doctors, listen to your doctors.
Yes.
Okay, Peggy, so let us recap for today's podcast. So, from what you said, we know that there are risk factors either modifiable and non-modifiable.
Yeah.
And everyone has the risk of getting cardiovascular disease.
Yes.
So, for modifiable, so remember to have a healthy lifestyle, more exercising,
Quit smoking,
uh,
manage your stress.
yeah, manage your stress. And also, even though we feel healthy, actually it's important to have medical checkup also.
Yeah.
So remember to consult your healthcare provider and also seek professional medical advice. Okay, so thank you, Peggy, for today's podcast. So see you, everyone.
See you. Thank
Okay,
you. Thank you.
Bye bye.
Bye. Thank you and happy World Heart Day. Use heart for actions. You could make a difference.